thankfully remembering my teachers in Government Ayurveda College, Trivandrum, Dr. G.S. Raju of Kottakkal Ayurveda College, and Dr. Samson Desaya, Professor, Head of Orthopedics in Government Medical College, Trivandrum, and my colleagues right from TSJN to the very youngest one, Dr. Jiku Elias Beni. Thanks to the office bearers of Global Ayurveda Festival for giving me an opportunity to present a subject in the global digital platform. As we are running in short of time, I'm just going through the slides very fastly. So, my previous speakers, they were all speaking about specific conditions like groin injuries, knee joint injuries, and Dr. Sivas has well narrated the approach to the spinal conditions. And just focusing on the repetitive strain injuries, that is a very, very important thing in the 21st century. See, trauma, it can be a direct one, can be indirect one, and the third one is repeated strain injuries. That is very, very common in the present scenario, which is to be considered by the Ayurvedic physician in their OPD as well as IPD. We get a lot of conditions as a result of repeated strain injuries. The mechanism of repeated strain injuries, that is too much too quickly, too heavy, inadequate warm-up, poor equipment, incorrect surface, poor techniques, maintenance, mechanical imbalance, previous injuries, poor healing, competitive pressures. And the precipitating factors are fast, repetitive movements, excessive load, inadequate training, unsuitable tools or components, poor workplace design, poor job design, poor posture support, cold and calm, vibration exaggerate the effects of movements, outside stresses. These are the factors contributing to the multiple repeated strain injury situations. So you can see that it is right from the skin to bone. The repeated strain injuries affect the not only the bone or fascia or tendon, it affects from the skin to bone. So you can see in the slides, skin, you can see bursitis can be there, blisters can be there, bursitis, muscle tears, tendon tendinitis, ligament strains or instability, joint that can create synovitis, capsulitis, and up to bone, it is stress fractures, usually avulsion type. So you can see the bursa. See, due to repeated strain movements, the usual affected bursae are the retrocalcaneal bursa, the bursa, trochanteric bursa. These are usually affected bursitis condition. And you can see in sports persons, iliotibial band syndromes are very, very common. You can see muscle injuries at various levels. It can be a muscle tear or a partial muscle tear or a complete tear, or multiple level of injuries can be possible in the muscular level. And you can see the compartment syndromes, compressive neuropathies like carpal tunnel syndromes and tarsal tunnel syndromes, like that one. Like epicondylitis, a result of repeated stress of muscles on the apophyseal area. The muscles which is attaching to the bony area, which is creating repeated pressure and creating a non-specific inflammation, which can be an epicondylitis. Usually, if it is a lateral epicondylitis, we used to call it as tennis elbow, and if it is a medial epicondylitis, we used to call it as golfer's elbow. These type of injuries are very, very common nowadays. And rotated cuff injuries, and not only in cricketers, sports persons, and those who are doing repeated fast movements of the shoulder as in their professional side, they're also liable for rotator cuff injuries at various levels. And you can see that Marx fractures is very common in sports persons. Not only in sports persons, those who are climbing steps for a long time, especially like Sabrimala pilgrimage and such things. When they are coming out from the field or after a journey, they used to see that swelling is there, and finally they can see a stress fracture of the metatarsal or any avulsion of the avulsion fractures like Jones fracture with the metatarsal, like that one. Okay, so the pathology of repeated strain injuries, the basic pathological conditions, the friction, stress, and ischemia. Three main causes for the overuse trauma or cumulative stress injuries are friction, stress, and ischemia. Friction, you know the explanation. The stress, repeated unguarded stress may result in tears of muscles or tendon, fibers, fracture, articular cartilage lesions, etc. Ischemia, it can be of two types. One is relative ischemia and absolute ischemia. These are the three steps, three factors contributing to the pathological factors for developing repeated strain injuries. And the diagnosis, usually an accurate diagnosis depends on the taking careful history. My respected Dr. Srivas told you that nowadays everybody is depending investigations for final any diagnosis without taking any accurate clinical findings or examination or like that one. So here, for the soft tissue injuries, especially the repeated strain injuries, we have to take the history, we have to examine the patient in proper, then only if it is not possible to get a provisional diagnosis or a final diagnosis, then only there is a need for higher investigations like MRI or advanced investigations like that one. So generally speaking, only basic case history taking and clinical examination and basic investigations like X-ray is the key to the diagnosis. And finally, you have to rule out possibilities like systemic diseases like polymyalgia rheumatica, early phases of rheumatoid arthritis, SLE, inflammatory arthritis, viral bacterial infections, generalized osteoarthritis, endocrine diseases, osteomalacia, Paget's disease, malignancy, a kinetic phase of Parkinsonism, fibrositis, psychogenic rheumatism. So you have to rule out all these systemic conditions before starting the treatment. Laboratory and advanced investigations are usually unnecessary for most of the condition. So you have to, when you are going through the clinical findings, Marma Bhigada Samanya Lakshanas are very important. Mamsa Asti Marma Lakshanas are there. Asti Marma Siddha Vidha Lakshanas are there. Sira Marma Snayu as well as Sandhi Marma Vidha Lakshanas are clearly indicated in our text, and which is a very focus for our clinical examination as well as diagnosis. And Ayurvedic concept regarding the etiopathogenesis of repeated strain injuries, Abhigadam or Abhigada Vishesham, which is leading to vitiated vada, secondary Rakta Pitta involvement along with the Kapha, Sthana Samsraya and Mamsa, Asti, Sira, Snayu, Sandhi, which leads to Marma Abhigada. The treatment protocol for repeated strain injuries, which I am focusing on four aspects. One is Marma Abhigada Chikitsa, and second one is Uttana Vada Rakta Chikitsa, and the third one is Bhankina Chikitsa, and fourth one is Snayu, Sandhi, Siragada, Vada Chikitsa. So, first of all, Marma Abhigada Chikitsa, it is highly specific according to etiopathogenetic factors. Specific Marma stimulations techniques. Dr. Srivas has elaborately discussed the various methodologies mentioned in Marma Chikitsa in Kerala as well as Tamil Nadu. Various types of bandagings, labors, Kshiradhara, Tailadhara, Pichu, all these are very significantly used in these type of injuries. And Vadarakta Chikitsa, Uttana Vadarakta, which is highly relevant in treating repeated strain injury situations. Therapies are highly significant. Lebanam, Abhingam, Parishegam, Avaham, with reference to different pharmacological preparations. Apart from the above said classical line management, the following modalities are also found clinically useful, which are Putabaga Leva, using specific drugs, potentially very significant drugs, especially in Kerala, Narembodal, Vallikanyiram, like that one. A lot of drugs are mentioned which we are using in our clinics for day-to-day management of the marma injuries. Pudabaga levas are being prepared with out of specific combination of drugs and which is being applied on the affected area. And marma levas, Ushmasveda, pressure bandages, Jalugavacharana and Agnikarma. These are all very significantly used in various situations of repeated strain injuries. And Dr. Sivas, as Dr. Sivas has told, Bhagna Chikitsa, the three basic concepts of Bhanga Chikitsa, reduction, immobilization, rehabilitation is always important in various stages of repeated strain injury situations. And finally, Snayu Sandhi Gatavada Chikitsa, Snayu Sandhi Siraprate, Sneha Daha Upanaham, which is highly relevant and which is being very breakthrough classical information to treat so many sports persons in my personal life for the last 15 years. It was a very useful methodology to treat on that line, Snayu Sandhi Sira Prapte Sneha Daha Upanaham. So, on conclusion, overuse injuries are elusive and insidious seen mainly in athletes, not only in athletes, those who are working too much too quickly. Repeated strain injuries can manifest from skin to bone. Diagnosis depends on taking careful history and through physical examination. Advanced investigations are not usually necessary in most of the cases. Treatment should start immediately. A delay with often means the optimum time has passed. Ayurvedic management of repeated strain injuries derived from four classical textual interpretations: Marma Bhigada Chikitsa, Vadarekta Chikitsa, Uttanam, Bhagna Chikitsa, and Snayu Sandhigata Vada Chikitsa. And Ayurvedic management of repeated strain injury situations should be a field of research and has tremendous scope in the area of vivid development in the sports and allied activities. Sports medicine should be necessarily be included as a postgraduate discipline in the Ayurvedic studies for scientific exploration and clinical practice. So, just listen to William Osler, listen to the patient, he is telling you a diagnosis. And nowadays, most of the physicians are forgetting this one and going behind all the investigations in the initial phase. Listen to the patient, he is telling you a diagnosis. Properly take the history, examine the patient, do minimum investigations, and if it is not possible, go for further advanced investigations and treat very carefully. Right. Thank you. Thank you to give me for Global Ayurveda Federation to give me an opportunity to present this very short paper. Thank you very much, Dr. George. I'm very indebted to Dr. George, my junior, and now he's a professor of Kottakkal Ayurveda College. Thank you, Dr. George, and all the office bearers of Global Ayurveda Forum. Thank you.